Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café, and today I have the pleasure to be with Dr. Larry Waldman, and he is recently semi-retired licensed clinical forensic psychologist trained in Phoenix and living in Phoenix, Arizona. He conducted a highly successful private practice of 45 years, working with children, teens, parents, couples, and adults in a solution-focused manner. He also consulted with family, personal injury, immigration, and estate planning attorneys. He has his PhD in educational and school psychology, which was earned in Arizona. And he was past president of the Maricopa Psychological Society and director of psychological services for charter psychiatric hospitals of Glendale. I mean, you've got so many things. I'm going to put this in our chat. You've written 7 books: Who's Raising Whom, Coping with Your Adolescent, How Come I Love Him But I Can't Live With Him. I love the titles of these. The Graduate Course, never had. Too Busy Earning a Living to Make Your Fortune, Overcoming Your Negotiaphobia, Negotiating Through Your Life, and Love Your Child More Than You Hate Your Ex. And your core passion currently is about teaching mental health practitioners how to develop a successful practice and become an effective clinician. As well, you're very interested in teaching parents to parent and instruct therapists to help parents raise responsible, resilient kids. So there's so many aspects to start with, but let me start with just asking you, what started this journey into this field for you at the very beginning? How did you know this is what you wanted to do?
Way back when people used to ask me when I was a kid, what do you want to do when you grow up? I used to say I wanted to be a psychiatrist. But a couple of pre-med courses more or less dissuaded me. And I decided, let's make that psychologist. So very early in my undergraduate years, I decided I was going to move in that direction. So I had a pretty good focus early on, and I also knew while I intended to do lots of different things, I felt I wanted to work individually with people in a private setting, which I did for nearly a half century.
But let me go a little bit, questioning that a little bit more. So I understand psychiatry to psychology, but what made you just know inside you that that's that kind of interchange you wanted to have with people?
Well, again, I can't really put my finger on it. My parents used to say that even when I was very young, I talked about getting on a motorcycle and driving to the Southwest. I was born and raised in Wisconsin. I don't remember that, to be honest, but here I am. I'm living in Arizona and have for, again, a half century. And I guess I seem to have people, my dad would say, you seem to have real insight and so on when I was younger. So I guess it came naturally.
Okay, very interesting. So one of the questions I really want to delve into is when you mention 4 schools of philosophy and the importance of really understanding that. So could you elaborate a little bit? First of all, what are they in your mind, and and why is it so important that therapists understand that?
Sure, thank you. Well, it is, to me, it is a very important topic. As you read, I am have been an adjunct professor of counseling for decades, and I like to teach young clinicians to be effective, and I'll admit also learn how to effectively conduct their practices, so that not only can they do a good job of providing therapy, but they can also eat and pay their rent as well.
Mm-hmm.
Frankly, a lot of mental health providers live check to check.
Yes.
There are basically 4 different views in the field of psychology. They are the biological view, the analytic view, the cognitive perspective, and the behavioral approach. And each one of them views views mental health differently. In other words, how they determine what the problem is, and of course, therefore, then they view the treatment in a different way as well. And so I contend that if you're going to be a successful therapist or clinician, you need to be fully versed in these 4 areas. Now, this sometimes is my first and second lecture when I do adjunct teaching. I know we don't have that time, that kind of time. So I'm gonna of course abbreviate it. The biological view, of course, is more actually, in your vein to some degree, although I understand you're a naturopathic physician. But the biological view is basically the realm of the psychiatrist, the physician, or nowadays the nurse practitioner. And again, in a nutshell, the biological view argues that what mental health issues are basically biological, physiological, genetic in nature, perhaps. They're a chemical imbalance within the brain, for want of a shorter term here. And that's their view. And therefore, the treatment from that perspective, of course, is a prescription, medication. Right? That's the biological perspective. The analytic view, or psychoanalytic view, as it's sometimes called, or sometimes the Freudian view, was first, purported by Freud in the late 1800s. And his view, basically, the analytic view, basically, is that mental health issues are the unconscious, unresolved concerns that the child had and now are manifesting themselves in their adulthood. So, for instance, if a patient is, let's say, depressed, the analytic therapist, instead, unless they're a physician, some analysts are physicians, unless they're a physician, instead of giving them a pill, an antidepressant, for example, take the view that the reason this person is depressed is that there's something back in their childhood that was never dealt with, unresolved. So hypothetically, let's say this child grew up in a home which was chaotic. Let's say the parents argued frequently, maybe mother perhaps was depressed herself, and so on. And so therefore, this child grew up in an environment where at any moment, at any time, something could happen. A pot could be thrown across the room, somebody could have a temper tantrum, a door might slam, and so on. And so the child then came to view their world as a dangerous place. as some place, as a place that could change on a dime, where they have no control, that they're insignificant, and so on. Well, you can see if that's what this child learned, and by the way, given their life at that moment, that's not unrealistic. They have an accurate view of what was going on. But what happens, you see, is the child then develops this life view and then carries it on into their adulthood. So now when they're a teenager or a young adult, in the back of their mind, you can't trust anybody. You're always on the lookout. Something could happen at any time. You're not likely to take a risk because, oh my God, you know, I don't have control. And you can see now where someone who is thinking, believing in this manner has high potential to be depressed. I mean, I don't matter. I don't have control of my life or my world. Anything could happen at any time. Of course, that even sounds like anxiety too, doesn't it?
Yeah.
And so on. So that's the analytic perspective. Now, the treatment then is what is referred to in that vein, catharsis, which is to make that person realize, right, why they believe the way they do, and take them back to their childhood and get them to understand that they're depressed because of these unconscious thoughts and feelings that they never dealt with. All right. The next view is the cognitive view. Now, these last two views, the cognitive view and the behavioral view, are sometimes referred to as contemporary perspectives because they came about much later. Obviously, the biological view is 1,000 years old. You know, we've been giving, herbs, and Aristotle was giving herbs to people, back when, and so on. And of course, as I said, Freud's work was in the late 1800s. In the early 1900s, we come to the two contemporary views. The cognitive view takes a little more of a simplistic approach and basically argues that what we think determines how we feel. How many times have you sat across from someone and in the course of the conversation, they put themselves down 3 or 4 times? Or they'll kind of flippantly say, oh, no, I was never good at that, or I'm just not good with numbers, or things like that. Okay? And what that reflects, of course, is that basically the way they see themselves, the way they think about themselves, indicates they don't have very good self-esteem. They don't see themselves as having any strengths and so on. And so therefore, again, from the cognitive perspective, someone who is depressed is someone who is thinking, basically the glass is half empty. I like to use the term, they have a bad case of stinking thinking,
Right.
as I like to refer to it. Okay? Now, the treatment in that case, of course, is to get the person to understand that what they're doing is basically negatively coaching themselves. I mean, for instance, a classic example, I've heard dozens of my clients, say this. Let's say they're about to do something, maybe on a blind date, let's say, they're just fixed up, or maybe a job interview, right? Either one, okay? Well, they're about to do this. They're about to walk into either the room or the cafe, to meet this person or to meet their interviewer. And what are they thinking? They think, they're thinking, oh boy, I'm probably going to screw this up. I never do well in these kinds of situations. I don't really have that much to offer. I don't know why I even thought about doing this. It's probably going to fail anyhow. And you can see they're already set up. And of course, what happens when you walk into that interview or you walk into that first date and you're thinking along those lines? Of course, it's already fated. You're going to fail. And then, of course, when you walk away from that interview or date and you walk back to your car, you get in your car and you go, I knew it. See, so it's a trap that people are into, and they can't get themselves out of it because they keep, again, this stinking thinking. Finally, probably the most contemporaneous view is known as the behavioral view. This came about in the mid-20s or so. It was popularized by Fred Skinner and so on. You're familiar with him, with the rat box and so on. But basically, what behavioral psychology talks about is who we are, what we become is a function of our behaviors and the consequences to those behaviors. So if someone is depressed, well, what's been happening is they've been doing things, and often failing at them, and so therefore, they continue to engage in self-defeating behaviors. I've had many individuals who that I work with, and so on, and often I'll say to them, you're doing a good job of depression. You're staying up late. You're sleeping through the day, so you're mixing your days and nights up around. You're eating junk. Okay, you're not answering the phone. You're not socializing. When you go out, you don't smile. You don't even brush your teeth. You wear old clothes and so forth. You look and act like you're depressed. So you're doing depression. I use behavioral psychology particularly when I work with parents, because it's the easiest, if you will, to comprehend and to implement. So, for example, I've been told many times by parents, I have to tell my child 5 times before they do something. I'm sure many parents can relate to that.
No, and I think I know where you're going with this.
And my response to that is, I wonder what your child has learned by your first request. And they often give me that puzzled look. And I said, well, from a behavioral or learning perspective, what you've taught your child is that the first time you ask them to clean your room means you don't really have to go and clean your room because there's 4 more requests coming. So why in the world would you bother attending to the first one? And see, parents unknowingly many times put themselves in these situations where they're sending messages and they're teaching messages to their kids that are working against them. So again, from a behavioral perspective, when I work with someone and I believe that the behavioral perspective is appropriate for this case, I'm going to help this person do non-depressive kinds of behaviors. I'm going to teach them to smile. I'm going to teach them to sleep in normal hours. I'm going to teach them to get some exercise. I'm going to teach them to eat appropriately. I'm going to teach them, to engage themselves and so on. And it's a funny thing how that works. Behaviorists have a motto, which I like very much, and that is, it's easier to behave your way into a new feeling than to feel your way into a new behavior.
Hi, this is a small commercial break, and for you to let me know that you're enjoying these conversations, please go 1, to subscribe to my podcast, number 2, write a review, because if you write a review on iTunes, more people know about this, and I can help spread the work, my work, but the work of everyone else I'm interviewing. And number 3, please sign up to my tips for your healing journey. And you can do that under www.drmanonbolliger.com/tips. Thank you.
Oh, I like that. It's easier.
It's easier to behave your way into a new feeling than what most people try to do is to feel their way into a new behavior.
Mm. Mm.
The best way to change a feeling
Yeah.
is to behave differently.
Mm-hmm.
Right?
Yeah, no, that's a good statement. So these are the 4 ways. Now, I would imagine that it's important for the clinician or the doctor to well, first of all, to know that they all exist, but to determine which one suits best the type of client you have in front of you.
Absolutely. Absolutely.
Mm-hmm. Mm-hmm.
No question about it.
Mm-hmm.
You know, if the patient comes in, for instance, and they're you can tell they're very intelligent and they live a lot in their head, and so on. You know, if I try to take a behavioral approach and say, well, you know, if you just made an effort to smile more and say hello to people, you know,
Right.
things could change. They look at, go, what? I'm paying you to tell me to smile? And wouldn't work. Okay. Now there's someone who probably is right for the analytic approach. Okay?
Mm-hmm.
For example, if I have a woman in my office, and she says, you know, I don't understand, but I keep choosing the wrong men. Immediately,
Mm-hmm.
that's an analytic approach waiting to happen, because you know, odds are there's some father issues going on there, either an absent father or some or clearly some disharmony early on in her life. You know, as Freud said, you know, the first relationship we have is with our opposite sex parent, not to mention our same sex parent. You know, so you know, if I get a question like that, then I'm probably going to take that approach. Frankly, if the client is not terribly bright, you know, I mean, you know, they're not a scholar or whatever, the analytic approach, you know, talking about unconscious things that we may not be aware of,
Mm-hmm.
you know, to someone who's got a low average IQ, what is that? That's voodoo. That's smoke and mirrors. That's not right. You know, they would rather have something very direct, like either the behavior approach or how about a pill? Won't that make me better? And so yes, the astute therapist has to basically size the patient up and determine, you know, which format, or maybe formats. You can mix them, if you will. You can use one or two, maybe not at the same time, but you can use one or two. But it's up to the therapist to find the right one. Now, unfortunately, if the therapist is not well trained and they only know one, well, then that's what you're going to get,
Mm-hmm.
like it or not.
Right. So in a sense, what I'm hearing you say is that it's good for the patient or the client to somehow be informed about the type of therapist that they're going to go to. It's like, you know, I use it in my, you're not going to ask a butcher what the right vegetables are to eat. You know, it's not going to be the same thing. So you have to align with the type of therapy that you feel resonates with you on some level.
You really make a good point. As a matter of fact, on my website, which happens to be topphoenixpsychologist.com, I have listed, or I've placed about 40 of my articles, which are available for download and so on. And some of those articles have to do with finding the appropriate therapist. And I think an astute patient ought to at least call the office and find out what kind of therapy does Dr. Jones or Mrs. Jones or whatever practice, okay? And so on. You may not have to talk directly to the clinician. I would think the office manager might know or should know, and so on. But yes, because the truth of the matter is, when you walk into a therapist's office, the average person doesn't know what they're going to get.
Mm-hmm. Sure. Mm-hmm.
And many people are, frankly, pretty naive in this arena.
Mm-hmm.
I mean, I've had cases where people were frustrated, and they've come to me and said, well, I saw Dr. Smith, my husband and I saw Dr. Smith, a couple of months ago for marital counseling. All he wanted to do is give us a pill. Well, he's a psychiatrist. Well, not that many psychiatrists, are versed in marital therapy. They have pretty much one tool, which is the prescription pad.
Mm-hmm.
By the same token, I've had people who come into my office and say, I need I want you to write me a prescription for an antidepressant. And I'll go, I'm sorry, but as a psychologist at this point, that's not what we do. I can help you work with this. I think I can help you, but I don't write prescriptions for pills. So a lot of people, truthfully, don't know the difference between a psychiatrist and a psychologist, let alone the different perspectives.
I think we cut out slightly, but just to make sure I heard you properly, most people don't know the difference between, not most, many people don't know the difference between psychologists and psychiatrists,
Exactly.
and let alone the 4 types of psychologists that one could go see. Yeah. Okay.
Now, just to muddy the picture,
Yes.
Actually in 4 states now, Illinois, Louisiana, oh my gosh, New Mexico, and one other that I can't remember, actually now have allow psychologists with training to dispense psychotropic medication.
Interesting. Just curious, because I am a naturopathic physician, and one of the things that we do is gut health, and we know a lot of neurotransmitters are made literally in the gut, and that of course affects the mind. How well versed do you feel that in general, I can ask you about psychiatrists maybe, but psychologists are aware of that biological option? Because of course we have drugs that can, or the goal of it is to modulate through neurotransmitters. And then there's what's coming to be much more known now is that really a lot of it is from the gut, which also affects your anxiety levels, your depression, all of that. How common is that knowledge?
Well, I think most experienced clinical psychologists have some familiarity with that. In fact, in my practice, I used to get calls from GPs all the time, asking what medication would I recommend. Of course, I would tell them that, look, I'm not an MD and so on, and they say, I know, but you work with this all the time. Now, I worked with psychiatrists, both in the hospital setting and in my own outpatient, in my building, in fact. There were 2 psychiatrists in our building. So I happen to be very familiar. And by the way, I don't want to go on record suggesting that I don't believe in medication at all.
Of course.
That's not the case. I mean, I've had cases, where my patient comes in for the first time and they are so anxious. I mean, they're wringing their hands, and so on, that it's immediately apparent to me that they are in no way ready to deal with any kind of talk therapy, if you will.
Yeah.
And that they're going to need some medication, to get some of this anxiety under control so that they could benefit, from some psychotherapy down the road. So if someone is extremely depressed, extremely anxious, extremely obsessive compulsive, hallucinating also, then clearly we need a psychiatrist, or nowadays sometimes a nurse practitioner. Absolutely. But it shouldn't end there. And unfortunately, now this is me on the soapbox, but I believe that, that giving a pill in some cases is very appropriate for the situation, but it shouldn't end there. And the research certainly backs it up. That the research is very clear, that a combination of the appropriate medication and psychotherapy is often the best way to treat most mental health disorders.
Yeah, because I from the patients I've seen over the past 30 years, I feel that way as well. I do feel like sometimes it's like an emergency stop so that you can get to the real cause and find out what that real cause is. And I think the systems you're saying is definitely a good system to figure out what the best approach is on one level. And sometimes the cause can be the gut, the fact that they're eating horrendous foods, they're not eating at all properly. Sometimes that is the cause. And sometimes it's also the autonomic nervous system. They're in like constant stress and they can't shut down. And so, some of the work I do physically, which I did not know when I started my practice. I thought I was doing a purely physical type of therapy. And I thought, okay, I'm just dealing with pain, that's it. And I didn't realize the impact, one, that pain could have on the whole person. And I didn't also realize how when you change the pain, the body will actually express all by itself what's going on, and so I see that it's really very connected. And when I moved my practice into Nova Scotia, I had a lot of psychiatrists, psychologists, therapists referring patients for the physical piece, even though none of us really understood why it was beneficial, and I think now the science is explaining it through the vagus nerve, like now we're starting to understand. But I certainly felt I could see the advantages, but I had no real understanding, why is it that there's an impact there, so have you seen in your experience with any, and I'm not sure it's all physical therapies that work either, I have not done a study on this, but I'm just curious, have you noticed any changes? Exercising is one type of thing, but let's say some of the patients who have, shortness of breath and other signs that easily get them anxious, when you relax their entire body, it's like their posture changes. Then you think, the posture, well, that's like a behavioral change, but now made possible because the body's relaxed, so it's like a chicken and the egg kind of thing, but positive, and
Yes.
Is that something you've seen or a consideration or?
Oh, well, yes, and I think again, experienced clinicians, are very familiar with this mind-body connection, um, and many times I'd make recommendations like yoga,
Mm.
join a gym, exercise, in fact, things like that. I would, and I'm no nutritionist, but I know a fair amount about it and so on. Actually, I am a certified fitness provider, although I just train myself and my family, that's all. So I'd recommend exercise. I would, I would hear what people's diets are like, and so on. I mean, some people, I remember I had clients who were struggling with anxiety, but in the course of a day, they would consume a pot of coffee and a 6-pack of Diet Coke. Well, that's enough caffeine to choke an elephant. And what does caffeine do, of course? Is it heightens, the body. It can generate anxiety on its own. And no one ever addressed that with that client, and so on. So yes, taking a look at what we eat and how we sleep and how we exercise and things like that are all important.
And what would you say, because I mean, currently we're in a situation where there's a significant increase in suicide, in depression, in, just because of the pandemic. What is your recommendation, or is there any take-home messages that you could see would be fit without it being like prescriptive in that sense? But I know it's always individual, but there's a lot of people that have been deeply triggered by this.
Right.
What do you recommend
They're
for them?
unprecedented times. I mean, they really are. And it's true that some people are struggling, but it's back to basics. I mean, I've had some friends I can see they probably have gained 10 pounds this month, and so on, because they're bored and food, certain comforts food make you feel better for the moment, of course, until you step on the scale, or you can't get your pants on anymore, and so on. But it gets back to basics. I used to go to the gym 4 times a week and do 2 yoga practices a week, which I can't do anymore. So I was up at 5:30 this morning and took a 12-mile bike ride while it was still cool, because it's right now probably 110 outside.
Oh my goodness, yeah.
Yeah, but did I want to do that? No, not really. I looked at the clock. I thought, oh, it'd be nice to roll over and get another hour or 2 or whatever, But here's back. What did I do? I behaved my way into another feeling. You see,
Right.
because when I came back from that bike ride, how did I feel? I was darn glad I did that. But had I given in, you see, tried to feel my way into the new behavior, I wasn't going to feel my way into that behavior because my feeling was telling me, stay in bed. But instead, I did what I know was the right thing. I needed that aerobic exercise. And while I've done several hundred yoga practices in a class, I can do a yoga practice on my own. So we'll do things like that as well. Plus, my wife got some of those bands, those, and so on, are not barbells, but they can work just as well. So it's doing the things we know are right, and sticking with it despite the tough times. Eating right, sleeping right, and getting on the phone, calling a friend.
Mhm.
Use the Zoom, and so on. In fact, after this, my wife informed me we're going to have a happy hour with 3 other couples on a Zoom thing. So there is going to be, this social connection.
Mhm. Mhm.
Well, that's what you have to do.
Mhm. Mhm. Well, I think it's a good suggestion. I love that statement. I'd never heard it, but about yeah, it's easier to behave your way to a new state rather than feeling yourself into it. And I think it's really a good way to it stops excuses,
Yes,
you
right.
know, because if you're going to make a behavioral change, if you make that decision and you know that the feeling may not go with it, then whereas I think there is, it's not a school of thought, but I think there's a confusion that the feeling is always going to be aligned with the behavior, but it's not. The feeling can trick you
Absolutely.
well, so it's I think that's very helpful.
You said something that just triggered me.
Hmm.
Because I got a couple of rocks, okay, that circular rocks, and I painted the letters TUIT on it. TUIT.
Yeah.
Because when I'd be sitting across from a patient and I would recommend something, like some more exercise or eating differently or something along those lines, and I would hear, well, doc, I'll get around to it. I said, just a minute, and I'd reach in my drawer and I'd hand him one of these rocks, and he would look at me, or she would look at me and say, what is that? And I said, well, you said you would do it when you got around to it. Well, there it is. It's round. It says to it. So go. And you know something? Many times they'd smile and go, all right, and they would go forward.
Yeah. Mm.
The point is, again, you have to act it, and then you'll feel it. Now, again, that's the behaviorist in me talking.
Yeah, no, very, very good. So do you have any, because you also said that this is very important for the healing journey, also of the practitioner, I'm imagining, because part of the practitioner is healing while they're in practice. I don't think we can exactly do one without the other entirely. But why, can you expand a little bit more on that statement? I want to make sure I've got your statement correctly.
I need a little more. Tell me some more. What you?
Yes. Okay. You said, yeah. So to determine what approach. No, I think it was more general that it's important that the practitioner understand which is the better journey. I think that's what you were saying. I was thinking you were going somewhere else with that, which intrigued me, but that's okay. That's fine. So do you have anything else that, because our time's wrapping up, and anything else you wanted to share? And yeah, and anything that I think you have some things, you have a million books, tons of resources, and
Sure, let me share that. Yes, as you said, I've written 7 self-help books, if you will. The first one is Who's Raising Whom, and that was my back quite a while ago, but it's been revised, and let me tell you, it's as relevant today as it was 25 years ago, and where I teach parents using behavioral psychology how to more effectively manage their child's behavior within the home. The follow-up book to that was Coping with Your Adolescent, and essentially it's using similar kinds of theory now with the teen, rather than with the child. And of course, you need to act differently, when you're trying to manage a teen than, of course, with a child. The third book was How Come I Love Him But Can't Live With Him? That's my marriage manual, if you will. And I talk about important topics like why marriages fail, how to maintain a marriage, why second marriages fail more frequently, and things along those kinds of lines.
So what, just for fun, why is it that you can love and not live with? What, I think I've opened up a big
Well, in a nutshell, I think the first reason is that we choose too quickly.
Mm-hmm. Okay.
Don't do our vetting, if you will.
Mm-hmm.
Too many people fall in love with love,
Mm-hmm.
and they're already emotionally committed by the second date, if you will, or they've already slept together, and so on, and now they're already committed, and they haven't even determined if there's a good value match. Does this person have the same kinds of values? Do they have the same kinds of interests? How do they manage their money? What kind of parent are they going to be? How willing are they to compromise? And all those important things that make up a good marriage, that's all by the board because they're really good in bed, you see. So enough on that, I guess.
Yes. Oh, that's good.
The fourth book is The Graduate Course You Never Had, and that's the book I wrote to help clinicians learn how to develop, manage, and market a successful private practice.
Mm-hmm.
And in fact, I do a lot of speaking across the country, for mental health associations, teaching therapists how to do that. The fifth book actually is related very much to what we're talking about here today. That book is entitled Too Busy Earning a Living to Make Your Fortune. And the subtitle is Discover the Psychology of Achieving Your Life Goals. Mm-hmm. And in that, I talk about the 7 basic reasons why we fail to achieve our life goals. And then what I do is I attack each of those reasons from each of the 4 perspectives. So it really does get at the 4 views and so on. And I'm sure some of those reasons, as you know, is we defeat ourselves. That's one of them, of course. We don't think we deserve it, and so on.
And then the other one, I'm curious. Yeah.
Okay. All right. The next one was Overcoming Your Negotiophobia. And that one I co-authored with a business analyst. And basically what that talks about is if you think about it, life is a series of negotiations. You negotiate with your children, with your team, okay, with your partner, okay, with your boss, with your coworkers, when you buy a car, et cetera, et cetera. So we're negotiating all the time. And it's important that we know how to do that. And finally, the book that just came out a month ago is entitled Love Your Child More Than You Hate Your Ex. Now this gets back to all of the forensic work I did in the family law arena. And I talk about trying to have what I call a healthy divorce, if you will.
Yeah. I think that's a very important thing. I think we often, I see couples that. May
I get my contact information again? Would that be all right?
Oh, absolutely. Yeah.
Again, my website is topphoenixpsychologist, all one word, .com. And you can buy my books there or through Amazon, of course. And you're welcome to download my articles. And frankly, if you want to send me an email and follow up on something I said, I'm more than happy to do that. My email address is Larry.
We'll put that in the contact information. Right, everything will be there. So, yeah.
All right. So I really appreciate the time you've given me here, and I think this is an interesting topic, and I believe an important one.
Absolutely. I think it is very important to get clear on what the goal is, but also the method that is most aligned with you. So, yeah. Well, thank you very much.
Well, thank you.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.